Now this question says that a 63-year-old male diabetic patient. Yes, in the last session you asked na. So this is a male diabetic patient hai. He has the diplopia which is worse on up gaze. 63-year male diabetic patient is there and he is actually having the diplopia which is worse on the upward gaze. Which is worse in the upward gaze. Can you do the CSF analysis on this case? CSF analysis is usually done in the cases where we are having the infections like tubercular meningitis and all. Not in these cases. So if you are suspecting some infective cause of the optic neuritis, then you can go for it. Okay. Now, here you have a 63-year male and a diabetic person who is having diplopia which is worse on up gaze. So, you are thinking about, see, whenever I have diplopia, I am thinking about what? I am thinking about the paralytic squint. Then we are thinking about the paralytic squint. Here we are having actually a paralytic squint. Now, squint is quite common in the patients who are having the diabetes. 63-year male patient hai, diabetic hai, and he is having diplopia which is worse on upward gaze. Now, because I am saying that diplopia is worse on upward gaze, I am thinking about some extraocular muscle palsy that is helping me to see upward. Now, which muscles are helping in seeing upward? Either we can have the LPS muscle or I can have the superior rectus muscle. LPS muscle ho sakta hai or we can have a superior rectus muscle. Now what they are saying, ductions are full. What do you mean by ductions, guys? We are saying that the ductions are full. So what do you mean by ductions? Pehli baat, the left eye is only elevating halfway. So again there is a restriction when we are looking up. So that is showing that there is a restriction in the upward gaze. So we are having some muscle involvement. What is the nerve supply of this? Pupils are normal. Pupils are normal. Are you thinking about pupils should be normal or not? Now we always know that we have pupillary sparing. Third nerve palsy. We have pupillary sparing third nerve palsy in cases of the diabetes as well as hypertension. Pupillary sparing third nerve palsy. ठीक है ना? So we are also comfortable with this because these muscles are supplied by third nerve. ठीक है? These muscles are supplied by the superior division of third nerve and we also have the pupillary sparing third nerve palsy. So I will not have the involvement of third nerve. So now based on this, we have to see which finding is most likely to accompany this examination. We will do true false type. ठीक है? तो अगर A देखते हैं, this is true or false, true or false, true or false and true or false. ठीक है? Now start with the option number D. Tell me about option number D. Is it true or false? Will you get chin down posturing or will you get chin up? See, if I am having the LPS palsy, ठीक है ना? LPS muscle की palsy है, that means we are going to get the ptosis. ठीक है? LPS palsy हो गया, ptosis हो गया. Now once we are having the ptosis, will the person do chin down or he will do chin up to see? What do you say? Yes, everybody tell me what are you going to get if you have ptosis? Chin up or chin down? Chin F तो है ही नहीं, कहाँ पहुंच गए नहीं मई, ABCD में से ही बताना है. तो chin up होगा या chin down होगा? See, when we have ptosis, the person will try to look up. So there will be a chin up position. Chin up position में we are going to get, therefore this is a false statement. We are not going to get the chin down posturing. ठीक है? Chin up होगा exactly. ठीक है? Now tell me about this. Are you going to get miotic pupil or dilated pupil? एक तो पहली बात ये कि they have said that you are getting pupils normal. ठीक है ना? They are saying that pupils are normal. So already they are saying कि pupils normal है. But even if you have involvement, will you get pupil dilated or miotic? If you are getting the third nerve palsy, right? Do you know that third nerve is the efferent nerve in the pupillary reflex pathway? It is the efferent nerve that we get in cases of the pupillary reflex pathways. So, will you get the pupil which is miotic or dilated? Another question. Are you going to get pupil which is miotic or dilated? Tell me about this. True or false? Is it true or false? Now, because third nerve is the efferent nerve that helps in constriction. So, obviously, if I have the third nerve palsy, I will not get a miotic pupil. So, I am going to get a dilated pupil. So, this is again a false statement. Are you getting this or not? Up you are left with the left nystagmus on the up gaze. Why we are having the left nystagmus? See, if you remember when I talk about the INO, है ना? So we were having one eyeball like this and we were having one eyeball. Mymet Academy is saying false. ठीक है. Nima is saying dilated. Dilated होगा ना? Now they are talking about nystagmus. Nystagmus actually, when do we talk? Nystagmus we talk about in the internuclear ophthalmoplegias में when we have the MLF lesions. Internuclear ophthalmoplegia, when we have MLF lesion, इसके बहाने you will learn the MLF lesion also. That is again very very good. ठीक है? MLF lesion भी पढ़ते हैं. So gaze की बात करते हैं. We are having horizontal gaze and vertical gaze. Suppose this is the right eye and this is the left eye. अभी समझो इसमें बहुत एक interesting चीज आ रही है, the gaze, because they are talking about nystagmus. And we have got the two muscles है यहाँ पर, lateral rectus, medial rectus and medial rectus and the lateral rectus हो गया. Lateral rectus, medial rectus, medial rectus, lateral rectus हो गया. Now I am talking about left nystagmus, ठीक है? Now what if a person has this MLF lesion? तो इस मीडियल रेक्टस को सप्लाई करेगा द थर्ड नर्व. दिस इज द थर्ड नर्व न्यूक्लियस. दिस इज सप्लाइड बाय द सिक्स नर्व. सो दिस इज सिक्स नर्व न्यूक्लियस. वी आर इंटर न्यूक्लियर ऑफ्थैल्मोप्लेजिया. दो न्यूक्लियस कौन से हैं? द थर्ड नर्व एंड द सिक्स नर्व. सो आई हैव अ medial longitudinal fasciculus here and I have the PPRF lesion here. PPRF क्या है? What is PPRF? Tell me the full form of PPRF. And we have roster interstitial MLF. You have to tell me this because PPRF is a horizontal gaze center and MLF is a vertical gaze center, horizontal gaze center and a vertical gaze center. Now this PPRF is supplying this sixth nerve nucleus. Sixth nerve nucleus is going to the lateral rectus, so this will help in abduction. And PPRF is also supplying this MLF. This MLF is going to this third nerve. Third nerve is going to the medial rectus, so this is doing adduction. So this is doing adduction and this is doing abduction. This is your right gaze. So this will be the right gaze. अब समझे, right gaze के लिए we require abduction of this eye, adduction of this eye. How both of these muscles are interrelated. Are you getting this? Hello Satvik. Yes, yes, I was busy in all other things, talking to the people who have given the exams. Thank you for missing me so many days. So I'm back here. ठीक है? So we have got the left eye abduction and we have got the right eye adduction. Now, when I have this MLF lesion ho gaya, it's not going here, it's not going here. So, right adduction, right ka adduction deficit ho gaya. And we have got the left abduction nystagmus. Left abduction nystagmus because now it's not going from the PPRF to MLF, so it is going increased innervation to 6th nerve nucleus. So there will be left abduction nystagmus. And you have not told me the full forms of PPRF and MLF. Avinash and Satvik, tum log batao. What are the full forms? PPRF is the parapontine reticular formation. Parapontine reticular formation. And this is your rostral interstitial medial longitudinal rostral interstitial medial longitudinal fasciculus. Rostral interstitial medial longitudinal fasciculus. Yes, very good. So, it is not a case of MLF lesion, it's a case of third nerve palsy. If it would have been a MLF lesion, then we would have said that it is a right MLF lesion, or we will say right internuclear ophthalmoplegia or left gaze palsy. Then I would have the left abduction nystagmus. So if you go to the question, that means this is also false. I'm not getting the left nystagmus. So what is the answer? Right upper lid retraction. Now can you imagine why we are having the right upper lid? Yes. Why we are getting right upper lid retraction? Try to understand. Because I am having the right ptosis. Right ptosis. So because of this ptosis, it is sending more innervation to the right LPS muscle. So it will try to send more innervation to LPS so that it can elevate it. So according to the Harring's law, there will be same more innervation to the left eye also. Now this eye is having the LPS palsy and this is your normal. So you know what is Harring's law? एक तो question ये है आप लोगों के लिए. And now which deviation is more? See, this is the squint eye. So this is primary deviation and this is your secondary deviation. And you know that secondary deviation is always more than primary deviation in the paralytic squint. So this will move more. This will lead to what? Which eye was having the paralysis? It was having the left eye paralysis, sorry. It was having the left eye paralysis. Left eye paralysis. So same amount is going to the right eye also. So therefore what will happen? Right eye will move more. So we will have the right upper lid retraction. So you will have the right upper lid retraction. What is Harring's law? And what is the name of the other law? What is paralytic squint? So there are two laws of innervation. There are actually two laws of the innervation. One is the Harring's law. Harring's law says that equal and simultaneous energy flows to a pair of yoke muscles. Equal and simultaneous energy will flow to a pair of yoke muscles. यहाँ पे yoke muscles क्या थे? When a person is looking, both are looking in the upward gaze. So we were having the right superior rectus and the LPS muscle, as well as left superior rectus and the left LPS muscle. So both the LPS muscles were your yoke muscles. So what amount of energy was going to the left one is also going to the right one also, because of this Haring's law. That is why we were having the right upper lid retraction. And the second is Sharrington's law of the reciprocal innervation. Sharrington's law of reciprocal innervation. What is this law? Reciprocal innervation. Yes. Increased energy to a pair of contracting muscles. We will have increased energy to a pair of contracting muscles accompanied by decreased energy to the relaxing extraocular muscles. So whenever, suppose we are looking in the levo version, so levo version muscles will receive more energy and there will be decreased energy. There will be relaxation of the other contralateral antagonists. These are the two laws. So Haring's law is applied here where we have got the right upper lid retraction.